Hello, good afternoon. Thank you for joining Health Watch Hackney's September Information Exchange meeting. Today we will be talking about sex and how to stay safe. Our great speakers today are Rebecca Flynn from Homerton Hospital, and she'll introduce herself shortly. And we have Peter Bampton from Positive East. He'll be talking about their services as well. I'll give the word to Rebecca Flynn. Yes, please go ahead, Rebecca. Thank you.
Hi, my name's Rebecca. I'm one of the nurses at Homerton Sexual Health Services. What I'll be doing is just a overview of what our services can offer, how you can access the clinic, and just, like some basic knowledge about STIs, contraception, and where to get help if you need it. So if anyone wants me to slow down or is having any difficulties hearing me or understanding me, please let me know, and we can go from there. So I work for Homerton Sexual Health. For some reason it's not letting me screen share now. Here we go. So we have 3 clinics. One is the Clifton Centre, which is in Homerton Hospital. We're open Monday, Tuesday and Friday 9 till 4, Wednesday 12 till 7, and then Thursday 9 till 4. And then we have an evening clinic again at 5 to 7. And the 5 to 7 evening clinic is especially for men who have sex with men. Then we have the Ivy Centre in Hoxton, and that's Monday, Friday 9 till 4. And then we have 80 Leadenhall Street, which is Aldgate East. And again, Monday, Friday, 9 to 4. All of our staff share responsibilities and roles within the service, and we all jump between each clinic. So the way the clinics are run is it's exactly the same how we would run it, say, for example, at Clifton Centre, than we would do at the Ivy. We offer a variety of sexual health issues, such as, so we do contraception, we do lots of coils, we do implants, pills, patches, condoms, injections, we do lots of different types of contraception. We do HIV care in the Jonathan Mann Clinic, which is in the Homerton Hospital. We do sexual screening for sexually transmitted infections, treatments for sexually transmitted infections. We do PEP, which is post-exposure prophylaxis. Does anyone know what that is, or wants to know what that is? So what it is if someone feels they've had exposure to HIV, I'm sure Peter can go more into this, he's more expert, then they can take some medication called PEP afterwards. So this can be accessed at A&E if it's not within clinic hours, and then the person who accesses the PEP can then continue with us, or if it's during clinic hours, they can come to clinic and we can give them access to this medication. Oops, sorry. And we also offer something called PrEP, which is pre-exposure prophylaxis. Again, so that's sort of the same, but what you do is you take the medication before to prevent you getting HIV rather than after an exposure. We do health advisor support, so health advisors kind of deal with more the emotional issues. We do post-sexual assault support, chemsex support, help with domestic abuse, and general advice, so someone doesn't have to come and have an appointment to get treatment or have anything particularly done. Someone can come in and chat about contraception or something that they're worried about. And a lot of the time, people might be booking in for a simple test, but there'll be something else there that they want to talk about or discuss. And our clinic's a very safe space for someone to do that. So basically, the next slide is about who can use our service. Everyone is welcome at Homerton, regardless of race, gender, whether you're a sex worker, whether you're a trans person, what your sexuality is, if you have a disability, if you've got a religious background or you can't speak English, whatever, everyone is welcome no matter what. We also have translator services at the Homerton. and all of our sexual health clinics. So if, in terms of information sharing, if there's someone who can't speak English, they're absolutely still welcome to use our service. And we have our own translators via the phone that we use. So the next slide is about sexually transmitted infections. Does anyone know what a sexually transmitted infection is, or doesn't know?
It might be useful if you give that information, Rebecca. Thank you.
So sexually transmitted infection is an infection that you can get through sex. Unfortunately, there is a lot of people have a lot of stigma and feel a lot of shame when they have an STI. But the way I would always say to a patient is, well, you wouldn't be upset or ashamed if you've got a cold or flu. And it's the same sort of thing, except cold or flu. It's a virus in a different area. And sexually transmitted infection, virus or bacteria in the genital tract or on the genitals. So there's lots of different types of sexually transmitted infections. We've got chlamydia, gonorrhea, herpes, HIV, syphilis, trichomonas, pubic lice, HPV, and Hep A, B, and C, just to name a few. So symptoms of an STI can be quite obvious, but they can also be quite subtle. So really the best thing for people to stay safe is to test on a regular basis. So symptoms can include change in discharge from the genitals. So when I say change in discharge, I mean change in consistency, change in colour, change in smell. If anyone's ever worried about discharge, then always just come in and don't feel silly for not knowing what type of discharge is right. And it's always good to come in and we can chat. Sometimes lower abdominal pain can be an indicator. However, there's a lot of organs in the area, especially the large bowel. Sometimes it can be due with more bowel issues, but if you are anyone having low abdominal pain, it's always worth coming to sexual health because it's something we can at least rule out. Some itchiness around the genitals or anal area, blisters around the genital or anal area, ulcers, pain or discomfort urinating, rectal discharge, that's from the bottom. So you can get warts as well, which would be a symptom of HPV. Testicle pain can be a symptom of an STI, and general pain in the genital area, or if there's any fever post unprotected sex, or any rashes as well. Again, very important to come in, get them checked out. A lot of these symptoms, such as rash is quite generalized, but it's always worth coming in, getting things checked out, getting your mind at ease, and we can just do a full screening, and at least it rules STIs out. So the way to prevent STIs is to use protection. And this is with barrier methods such as condoms, dental dams, which is what we can see my mouse here. And that's usually used for oral sex or rimming. Does anyone want me to explain what rimming is?
I think that will be useful as well, Rebecca.
Yeah. So rimming is is mouth to anal contact done for sexual pleasure. At the bottom here, I've just put this image here for size. There are a lot of different types of condoms. This is the most common one here, which is the male condom. So that's put on the penis before sex. This one at the bottom, this one is the male condom. But this one here is called a female condom. So the way that works is the woman can put that inside her before sex. And this is a really good option because it does give women a bit more control over the sex that they're having. Although the male ones are a lot more popular, but there are different types of protection out there. So it's worth knowing about them all. The next slide is about testing. Some people don't use condoms, or they feel they can't, or they might not have any condom negotiation, or they do use condoms, but we should always get tested anyway. So in terms of where you can get tested, you can go to a sexual health clinic. So they're the ones that I've mentioned in the previous slide. You can get home sexual health tests for people with no symptoms, and that's on Sexual Health London. And then what happens is they send you a free sexual health kit to your home. You do the test and then you send it off, and it's all for free. However, the bloods people struggle with a lot. So you have to go at the end of your finger. I don't know if anyone knows how to do a diabetes check. So it's like a little pin, like a lancet that goes into the finger, can be quite sore, and then you just get blood out that way. A lot of people aren't able to do that, or they don't want to do that, which is completely fair. So they can always come to the sexual health clinic and call up for an appointment. You can always get you can always get tested at the GPs and some pharmacies as well. And in terms of how often you should test, again, it depends on how much sex you're having and who you're having it with. So essentially, we would suggest that every change of partner is a good idea. Or if you're not sexually active, if you're not changed partners, then yearly would be a good idea. Usually 3 months is a good, if you're having quite regular sex, 3 months is a good amount of time to test every 3 months. So next I'm going to talk about sex safety. So this is really broad. I'll just gloss over some points. But it's a very broad term. So I'll start with number one, which is using condoms. So using condoms can protect you against STIs. If anyone knows anyone or feels they're unable to use condoms, or they feel they're they're not able to negotiate condom use, again, we have services for that. Come into clinic, we can, health advisor can chat to you and sort of help to develop those skills, because it is an important skill to have. And it's obviously okay to not use a condom, but it has to be both people's decisions. It can't be one person pressurizing the other person. So condoms are very important, and learning to negotiate is a really important skill. In terms of like hookups and apps, again, they're very popular now. In terms of sexual safety, if you are using them, just always let your friends know where you are. If you're meeting someone, having a hookup, send your location. You could say to your friend, if you've not heard from me by then might be worth like calling for help, etc. Number two is consent. That's a really big one. So it's understanding it, and that means that all partners want to have sex without being controlled in any way or manipulated with the use of alcohol or drugs, or pressured. Because a lot of people may have sex, but they might be really drunk, or they may have not made that decision had they not had a lot of alcohol. And we do see it that sometimes people come into clinic and they felt like they have been manipulated into sex. So again, consent, and never assuming consent from a partner, always checking first, is really important. And the golden rule is consent can be drawn at any time. So that basically means if two people have been having sex for a long time, so like a husband and wife, and one person says no, that means no, not because you've been having sex before and you're married. It's always a yes. So that's the golden rules. Consent can be withdrawn at any time. In terms of drug and alcohol safety, it's just this was more made for university students, but it would apply to anyone in terms of drinking and drugs. At events, if you ever feel unwell, just talk to stewards, medics, security at clubs, call 999, and I've got some resources there if anyone wants to explore that further, which is in my resources page at the back as well. And then this is for everyone, just looking out for your friends at all times, sticking with your friends and people you trust, having meeting point if you're out and about, and if your friend feels uncomfortable with someone's behavior, report it to security, and that can be events, clubs, or if you're in a bar, you can ask for Angela. That's sort of a scheme where if someone's making you feel quite uncomfortable, what the bar staff will do is they'll get you out safely. And most bars, clubs, restaurants UK wide are aware of this. And yeah, there's no harm in reporting someone's behaviour if it's making you feel uncomfortable, and or then there's always the police to report behaviour to as well. The next part is about contraception. So contraception is something you can take. There's different methods you can take to stop a pregnancy from occurring. So there's different types. There's one you swallow, so that's like the pill or the mini pill. Ones you put on, that's condoms, patches. Ones you put inside you, injectables, diaphragms and rings. Ones you just put in and you forget about for a long time, such as coils and implants. And then there's also apps such as Natural Family Planning. So hormonal contraception is the use of hormones to prevent a pregnancy. And essentially these work by stopping and reducing ovulation, thickening cervical mucus to stop the sperm entering the uterus, and thinning the lining of the uterus so a fertilized egg is less likely to attach. There's so many different methods of hormonal contraception, such as pills, implants, injectables, and there's also a hormonal coil. However, there can be some side effects with the hormonal contraception, although they are very effective. And sometimes people need to find that they might need to try a few pills or try a few methods till they find the one that suits them. And just because one suits one person doesn't mean it will definitely suit someone else. So side effects can be change in bleeding pattern, no bleeding at all, some acne, clear skin, headaches and breast tenderness. And these ones usually go after a few months. And we've got our non-hormonal methods, which are becoming quite popular because a lot of patients seem to not want to be putting hormones in their body at the moment. Again, like use of condoms, copper coil is absolutely fine. In terms of the apps, we don't warn people against it, but we just say use them with caution, because a lot of these companies such as Clue and or the cycles, whatever, Natural Cycles, they'll advertise that they're 99.9% effective, but they're not really. They're more, with typical use, they're more like 60%, which it seems high, but it's actually, if you're wanting to prevent a pregnancy, it's not the highest when you could be having a much higher form of protection. But used perfectly, then they're relatively accurate. So non-hormonal contraception works by acting as a barrier, so that's condoms, killing sperm, which is a copper coil, or using methods such as natural family planning to predict fertile and non-fertile days. So side effects of non-hormonal contraception, there isn't really any, because you're not taking any hormones. However, the only side effect or the downside of the copper coil is it can make your periods longer, heavier, and more painful. However, this does tend to settle after 6 months of use. So emergency contraception can be used after unprotected vaginal sex. You can get this from a sexual health clinic, that's us, or a pharmacy for free. There are several pharmacies that you can go to in Hackney that are free. I don't have the picture up right now, but
I have it, and I'm happy to include that in the post email. Post-event email.
Perfect. So it will all be sent in the post-event email. There's quite a lot of pharmacies on there that you can get the emergency pill from. Again, there's always a sexual health clinic as well, so you can always feel free to call us. Or then there's always the copper coil, and that can be fitted 5 days after unprotected sex. In terms of the emergency contraceptive pill, it only works by delaying ovulation. So if you've already ovulated, it's not going to work. However, if there has been any unprotected sex and you don't want a copper coil, then really the emergency contraception pill is the only fallback. So it's always worth doing, but it's just to say that it may not work. It's not 100%. So Levonorel needs to be used within 3 days, and Ellaone needs to be used within 5 days. So a lot of people think, I've had sex this night, I need to get one straight away. And it is better to get it the day afterwards or as soon as you can. However, there is some leniency, so you can get it 5 days afterwards if you're having Ellaone, or 3 days of Levonorel, which a lot of people don't know. So I don't know if it's question time, if anyone wants to ask me questions, or is this after all the talks?
Yeah, usually after you finish your presentation. Are you ready with that now?
Yeah, so just
Okay.
if anyone has any questions, then
Thank you for the excellent presentation, Rebecca, first of all.
thank you.
Any questions from anyone? No? If not, I'll have a couple of questions, Rebecca.
Okay.
So if someone comes to you with symptoms that are they're not within your remit, would you refer them to specialists, or would you refer them back to their GP?
Yeah, so it depends what the symptoms are. So obviously we would always do our investigations first if the patient consents to them. So that's sexual health testing, and it depends on the type or the symptoms. So for example, if say someone comes in with I don't know, like a symptom such as bleeding after sex, and it's say a woman in her 50s, yes, we can do our full sexual health screening, we can do all the examinations, we can look at the cervix, we can check the smear record. But in terms of like, if it's beyond our remit, in terms of we think she should get seen by someone else or referred to by gynae, for example, we would do that referral then and there. So the patient doesn't need to go through back to their GP, then to different people in the hospital. We would do our referral and then they will contact the patient. However, if it's something that's not within hospital, so just say someone comes in with lower abdominal pain and we do an examination, we find that it's not caused by sexually transmitted infections, we would then suggest the patient needs to go to their GP. So essentially there's two types of, we do all the symptom investigation. We'll either, if we can't deal with it, then we'll either suggest the patient goes to the GP, or if we feel it needs to be a hospital investigation, we'll refer in the hospital.
Well, thank you. And maybe very quickly, if you mention again about how to access your services, whether it's self-referral, they have to be referred by a professional, by their GP, for example.
No, anyone can access our services. It's a self-refer service. I'd say that is the best way to go about it, because if you're waiting for someone else to refer you, it can take a lot longer by the time someone picks that referral up and makes you an appointment. The best way to get into our services, either calling our number, which I can send to you afterwards, and you book an appointment for a reception. And then, you can always walk in and you can ask for an appointment. We won't be able to see, we don't take walk-ins in the sense that like you can't walk in and get an appointment there and then, but you can the receptionist can make one for you for a later date. A lot of people find that a bit easier because it can be quite hard to get through on our phone line sometimes. And if there's anything really urgent, again, just walk in. Like we will take, emergency contraception, generally sexual assault, or anything urgent, like just walking in is also fine. And we may not be able to guarantee seeing you on that day, but we can certainly fast track you to see you as soon as we possibly can. I think that's pretty much
it. I think you also have online booking as well, don't you?
We did, but we currently don't have that now just because of monkeypox. Due to the high demand in monkeypox cases we've been seeing in the clinic since probably like May, June time, we've had to get rid of the online appointments. I think there is some hope to get that up soon though, but I'm not too sure when.
Oh, I see. Okay, thank you very much. Any further questions for Rebecca? If not, let me just see. If not, then thank you again, Rebecca, for the excellent presentation. Peter, it's your turn now. Are you ready to go ahead?
Yeah.
Very good. Rebecca, if you stop sharing, then Peter can do the sharing from his side.
Sorry. Oh, here we go. Stop sharing. Perfect.
Thank you.
Okay, thanks everyone. So my name's Peter. I'm the head of prevention and testing services at Positive East. So Positive East has been at the forefront of HIV service and care for 31 years, and we support people from point of diagnosis through to long-term care. And what we really focused on is improving the quality of life of individuals and communities affected by HIV. All our services are free, confidential and non-judgmental for anyone aged 18 plus. But we also have a new project called Community, which is for City and Hackney residents aged 16 plus. So in terms of our coverage, we are operating across 8 North East London boroughs, so City, Hackney, Tower Hamlets, Waltham Forest, Newham, Redbridge, Barking and Dagenham and Havering. And why I think this is also important, even if you are a City or Hackney resident, or if you access services in the borough, we're acutely aware that still for some people, sexual health, there can be a stigma that carries with that, or a fear of being seen to access services. So you're also welcome to access any of our services in any other boroughs. You don't need to live, work or play in those boroughs. So if you went onto our website and you saw, say, a testing service in Redbridge, but you live in Hackney, that's completely fine for you to access that as well. So in terms of the services we offer, I've broken it down into kind of services for those who are affected by HIV and then services for people living with HIV. So we offer free HIV and STI testing. We do sexual health information advice, either over the phone, email, in person with information stalls. We're also on a range of hookup apps like Grindr, Growler, Scruff, Jacked. So what we want to do is make sure that people can access information and advice on their own terms. And it's really important, again, that we relay it in the language that's really accessible to you. A lot of our workers speak a range of community languages. I want to say about 25 to 30 different languages. So yeah, we can make sure it's something that works for you as well. We also offer a range of workshops that we can deliver in the community, and that might be anything from healthy relationships to navigating pleasure, consent and boundaries, like Rebecca said. And we can also deliver training to professionals as well. So if you work in the community or you provide healthcare services in City and Hackney and you'd like some updates around HIV awareness, or maybe are learning about how we're supporting marginalised communities, please get in touch as well. You don't need to kind of run a big business, even if you're just a community group and you want to upskill your workers. Anyone can be affected by HIV, and it's important that we know how to respond if someone felt confident to open up about their HIV status to us. So for people living with HIV, we offer a range of one-to-one support. So that could be something like peer mentoring. So spending some time with someone else that's been on a HIV journey, counselling, maybe psychotherapy. We offer group support and workshops, including a newly diagnosed course, sort of performing arts sessions. So finding a way to share your story and fight the stigma that you may have faced, but also thinking about other things that may impact your status and living well with HIV. So information and advice around immigration, benefits, financial support, housing. We're really considering that particularly whilst we're in this cost of living crisis, energy bills going through the roof, that can really impact people staying well with HIV as well. So I thought it was really important also to highlight the importance of language and how that's also we often find that HIV and AIDS is used interchangeably. So HIV stands for human immunodeficiency virus, and it's a virus that attacks the immune system and can gradually cause damage if it's left untreated. Whereas AIDS is not a virus, it's a set of symptoms or syndrome that's caused by the virus. And over time, that can compromise the immune system. It may mean that someone faces other diagnoses as a result of that impact. But we're more likely to use the term late-stage HIV diagnosis because of developments in treatment and diagnosis. And if we think about the AIDS pandemic, which for a lot of people, that was the first pandemic that they lived through, the language was used in a really stigmatizing way. And so, yeah, language is so important about how we talk about sexual health and the impact that that can have on different communities, and maybe their concerns about health outcomes, about how to talk to their partners about a HIV diagnosis. I also wanted to highlight who's impacted by HIV. HIV doesn't discriminate. Anyone can get HIV, but certain communities are disproportionately impacted. So on this slide, if you look along the bottom row, you can see kind of the assumed routes of exposure. So we can see in London that gay and bi men and other men our sex of men are disproportionately living with HIV. And there's two columns that you can see within each assumed route of exposure. So you've got kind of like this darker turquoise and then this sort of brighter aqua color. So the darker turquoise is those who are living with diagnosed HIV, and then that brighter aqua color is undiagnosed HIV. So you can see, particularly when we look at gay and bi men, they're more likely to be living with HIV, but more likely to be living with diagnosed HIV, whereas other communities may be more likely to be living with undiagnosed HIV as a percentage. And the only way to know your status is to test. But we know that being from marginalized communities and kind of like the additional barriers that people face, we're really passionate about addressing some of those barriers and understanding that we play a role in challenging some of that. So that may be things around racism, homophobia, biphobia, transphobia. We know that there's a hostile environment to migrant communities. In any way that we can support people to navigate services and build that rapport with people, we really take that on board and want to take our communities out, our services out into the community. And advocacy is a really big role in that. So meeting other members of the community who are delivering our services, and then maybe supporting you to access services like the Homerton as well. So if you do have any concerns around sort of confidentiality, how it might impact your immigration status, maybe anything around kind of like transport costs, anything like that, please get in touch and we'll find a way so you can make sure that you're on top of your sexual health as well. So kind of expanding on what Rebecca was saying as well in terms of the different ways to test. So if you went to a sexual health clinic, they would draw your bloods and then they would screen that and process it. And we have what we call a window period. So when the test is going to be most accurate at telling you whether it's picked up HIV antibodies. So if you went to a sexual health clinic, that usually has a window period of 6 weeks. And then if you ordered a test at home or if you tested with Positive East, it has a window period of 3 months. And sometimes you might hear the terms self-sampling or self-testing being used interchangeably. Self-sampling basically means that you're taking your blood at home and then you're posting it and then you're getting your results usually between 5 to 10 working days. Whereas the self-test is where you will get your results there and then in the session. So the test that we use at the moment is Simplitude test. The results will develop within 15 minutes. So if you test with Positive East, you'll get your results within that appointment. I think one of the concerns that people have is around the confidentiality of the service. So we wouldn't share your information with another service unless you asked us to do a referral or it did pick up HIV HIV antibodies, and then we would need to send you for blood confirmations that it's definitely picked up HIV. And then another concern is sometimes the amount of blood it takes. So it really is just a finger prick of blood to know your HIV status. So if you are a bit squirmish, don't worry, we can help you with getting your blood sample out. And like I said, it's a really, really small amount. And then, yeah, other ways that we test for STIs. So we use some test kits, so that can include the blood plot, which will be screened for syphilis and hepatitis B and C. And then depending on the type of sex that you're having or your body, it may be a urine sample or a vaginal swab, and then a possibility of an additional anal and oral swab, and they'll all screen for gonorrhea and chlamydia. So if you've got your handle on a COVID test and just twizzling that round a couple of inches inside, that's kind of very similar to what an STI test would entail in terms of screening for gonorrhea and chlamydia. And again, if you've ordered a home test kit and you're struggling to get the blood out, you're more than welcome to book in a testing appointment with us, and we'll give you some tips and tricks on how to get a full blood sample for that to be processed correctly. And then in terms of us taking our services into the community, in terms of Hackney, we test at a range of community venues, including Crib, Hackney CVS, Dalston Superstore. We're also really fortunate to have a mobile testing van as well that goes to Clissold Park, which the times change depending on when sunset is. And we also do pop-up testing clinics at places like Ridley Road Market and festivals as well. So again, just normalising and giving that opportunity to test either after work or on your lunch break and stuff. We're really conscious that we don't want it to feel like sexual health is something that you need to seek out. It's something that can be normalised into your everyday routine. So going on to, yeah, what Rebecca said, there's loads of different ways that we can now prevent HIV. I think for a lot of people, all they've heard is condoms, condoms, condoms. And yeah, there's so much we have, and we sometimes call that our HIV prevention toolkit. So we have testing, like I mentioned. We've got condoms and lube, and like Rebecca said, they come in loads of different shapes, sizes and formats, whether that's an internal condom, whether it's a dental dam, you can get ones that glow in the dark, ribbed, different sizes and textures. And yeah, it's the best way in terms of preventing HIV and STIs. And then in terms of HIV only prevention options, like Rebecca said, there's medication called pre-exposure prophylaxis. And you can get that through sexual health clinics or through a website called I Want PrEP Now. If it's something that you're really interested in accessing and you don't know where to start, you can call up the clinics, or if you'd like us to do a referral on your behalf, please get in touch. Or if you want to talk about how PrEP might be something for you as well, I appreciate it's a real big transition for people that have seen a physical barrier. But imagine it like a medical version of a condom to prevent HIV. And it's just a pill that's taken on a daily basis, particularly if you're having frontal or vaginal sex, you take it 7 days before and 7 days after sex. But if you're having anal sex, you can take it less frequently. It's what we call event-based dosing. So you can have as little as 4 pills would prevent HIV. And that's particularly useful if you like the feeling of skin-to-skin contact and that sense of intimacy that sometimes can come from that. We've also had amazing developments in HIV treatment as prevention. So you'll sometimes see that referred to as U equals U. So someone who's positive and on effective treatment, they can reduce the number of copies of HIV in the system, which means that they can't actually pass on HIV if they're on effective treatment. And it stands for undetectable equals untransmittable. And there's a really great study called the PROUD study that tells us that it's factually and medically correct, that someone can't pass on HIV if they're on effective treatment. So again, how do we talk about HIV in a more positive way and feel comfortable to talk to our partners? Everyone has a HIV status, and then how the conversation goes from there about what prevention tool you might use. And then lastly, in our toolkit, we've got PEP, which stands for post-exposure prophylaxis. And like Rebecca said, you can get that from a sexual health clinic, or you can also get it from A&E, but you do need to take it within 72 hours, ideally within the first 24 to 48 hours after exposure to HIV. So again, this is medication taken by someone who's negative, who may be exposed to HIV. And then I just wanted to highlight the importance of taking those services out into the community. So like I said, we do pop-up testing services. We can do workshops and activities or drop-in spaces. So if you run a community group or you've got an event coming up and you really like us to have a presence, and we can also do referrals and help you engage with sexual health and primary care services. So that can include as well, if you know that you're living with HIV and maybe you're struggling to take your medication, or you have some doubts about the effectiveness of your medication, please get in touch. There's no judgment, there's no right or wrong way to approach HIV. And that does come with a lot of different things that can impact our thoughts on that. It could be a cultural thing, it could be a religious thing, it could be kind of pressure from partners or family members, and we're here to support you in that process. So this is what our mobile testing van looks like. It's like a caravan. It's got 2 testing rooms on it and some of our lovely staff and volunteers outside it. I also wanted to celebrate some of the successes we've made in HIV as well. Like I mentioned, there's a toolkit that's really helped us advance, but we have a set of targets called the UNAIDS targets, which mean that we aim to diagnose 90% of the population who are living with HIV. We aim that 90% of those who are diagnosed are on treatment, and that 90% of those who are on treatment are virally suppressed and can't pass it on. So in England, 95% of the population living with HIV is assumed to be diagnosed with HIV. 99% of those who are diagnosed are on treatment. And then 97% of those who are on treatment are virally suppressed and therefore can't pass on HIV. So that fear of coming into contact with the virus means that we can look more at people who are living with HIV and really taking some positive action to be taking their treatment and be living well and thriving with HIV. And those health outcomes are fantastic for someone who's HIV positive and on treatment. And if my maths are correct, it also means that in total, around about 85.7% of all people with HIV in the UK are virally suppressed and therefore cannot pass on HIV. It's just where people don't know their status, where they're going to be more infectious. So the quicker we can get you diagnosed on treatment, the better in terms of your health outcomes. And this is a couple of the ways that we've helped people kind of have conversations about PrEPs. So we've got a PrEP mix stand with some sweets. We've got loose condoms and lube. We've got some resources in there. And we've also got an STI Smackdown game. So if you want to learn more about what that sort of odd looking fluffy pink worm is, it's syphilis. And yeah, you can win like glow in the dark sperm key rings and stuff. And so again, if you've got events or things coming up that you'd like us to have a presence and have a chat to people about HIV and STIs, please get in touch. And then I won't labour over these next 2 slides too much, but we have free training for professionals. Like I said, HIV awareness training, we can do it in person or on Zoom. We can give you a bite-sized lunch and learn or coffee morning session if you already feel fairly clued up, but you want to learn a bit more about PrEP and You 'Cause You. And like I said, are learning about supporting people from marginalised communities. And again, if you run any social or support groups, community groups, we can tailor different workshops that can be really interactive, again, over Zoom or in person or on Teams. And that includes things like a Pride in Prevention, so learning about the journey we've been on as an LGBTQ plus community, about tackling one of the first epidemics, challenging some of those myths around feminine hygiene products, body image, and seeking out pleasure. And again, like Rebecca said, chemsex has really impacted gay, bi, and other men have sex with men. So we can give you some tips and tricks around harm reduction, maybe navigating hookup apps and how to communicate the sex that you want to be having. But also we're seeing that rise in monkeypox as well, and how that may be impacting the sex you're navigating or how you have conversations with your partners as well. So if you need any tips and tricks, we're here to help. And then, yeah, you can follow us on Facebook, Twitter, Instagram at Positive East, and drop us an email or give us a call if you've got any questions or you'd like to access our services.
Excellent. I guess this is the end of your presentation, Peter.
Yeah.
Thank you. Thank you very much. Wonderful information, really. I personally myself learned a lot, and definitely there is more to learn as well. Any questions for Peter? No, I think it was explicit as it was Rebecca's presentation as well. We don't have any more questions, but we have another 10 minutes to go. Would you, Rebecca or Peter, have anything else to add to your presentations? Let's maybe, Rebecca, we were talking about access to services, and you said there is no gap. We may not see you on the same day, but we'll see you, as soon as possible. And you also mentioned about different clinics that you run within the services. Is there, what the rough waiting time might be for most of these services, or?
Oh, generally just like 1 or 2 days. If there's something very urgent, then we will address and we will try and see someone on that day. However, it can't be guaranteed if we've got very short staff, or if someone comes to us at like 4:30 in the afternoon, we can't always see that person on that day. Generally, if there's something very urgent, we will see that person within that same day if we can. If not, then it will be the next day. Generally, if someone's to book an appointment, then they could be, it depends on when they want it, and it depends how busy the clinic is, because when it's very busy in clinic and there seems to be a lot of patients, then yeah, you could be waiting for a week for the appointment. Whereas there's sometimes just less busy times in clinic, and then you could be waiting a couple of days for the appointment. But really, patients won't be waiting more than a week, I would say, to be seen.
And what would be classified as urgent?
Anything sexual assaults, emergency contraception, diagnosis of an STI, so needing treatment, and I guess certain types of symptoms could be classified as urgent, such as really excruciating testicle pain.
And would you then advise people to go to A&E when it's out of hours for your services?
Yeah. So anything post-sexual assault, go to A&E, or if there's like symptoms such as severe pain, go to A&E. Anything that feels severe, then go to A&E. But I would say like symptoms such as thrush, you don't need to go to A&E with that, or thrush-like symptoms. You can wait for the appointment to be seen with us at Clifton Centre. Does that make sense?
Yes, perfect. Thank you very much, Rebecca. Peter, anything from your side?
I think just to reiterate what Rebecca was saying, that if you do notice those changes to your body, don't feel it's something that you need to kind of like persevere through. I think with something like HIV in particular, I think we can easily discount some of those symptoms because it may fall in line with kind of like COVID symptoms or flu-like symptoms, particularly as we're going into the autumn winter months as well. And the only way to kind of eliminate, actually, could that be HIV, is to take a test. And likewise, in terms of those STIs as well, is some of them, like syphilis, can be a bit deceptive, that actually some of the symptoms may clear up, but actually that doesn't necessarily mean that the syphilis has gone away. So being in that routine of testing, I do totally understand why some people may not choose to seek out a test. It may be that it's hard to get an appointment, or you're worried about that test being posted into your own home, but there's other solutions. So if in doubt, call up, email, send a message on a Hookup app, and let us help you navigate that. You shouldn't have to face any of that by yourself. And if you're carrying any sort of shame or stigma or anything, there's no judgment from Positive East or Homerton staff. Like we're here to help you navigate those spaces, and again, help you navigate some of those conversations as well. So I know some of it is kind of like, oh, I don't know how I'd then tell my partner, but we have different things in place to support you with that.
Very good to know. Thank you both very much. And very last question from my side. In terms of the support that GPs can provide to people who perhaps won't come to you, Peter, or go to sexual health services, what kind of support GPs can give? Rebecca? Peter?
So in terms of support GPs can give, I mean, a lot of the time GPs will refer on to us, let's say go to sexual health. Really, like GPs could do more testing at their clinics, but it depends on the GP. Sometimes you find that, you know, a lot of GPs are quite on it with their testing and some are not so much, and they might just say, go to sexual health. What I would say, just in terms of getting a test with no symptoms, patients can walk in, and sometimes we can see them staff dependent on that day for a test only. So yeah, it depends. Like if someone needs an urgent test, then generally we can try and see them. But it's usually best to call up ahead, because it would be hard having to make the journey and then to be turned away just because we're, you know, being low on staff, and unfortunately staffing is a bit of an issue across the NHS at the moment. But yeah, I mean, I think it varies from GP to GP from my experience. I think there's a lot of doctors who do a what's the word? They do a bit of a rotation. Maybe the GPs who have done a sexual health rotation kind of are a bit more aware of sexual health. But you know, there's a lot of GPs who are not necessarily sexual health trained. So.
Thank you.
Yeah, I would say obviously signing up for our training sessions, getting in touch, so we can kind of give you those updates and how to initiate conversations. I think sometimes it's speaking the words into the open that can remove that shame and stigma and fear, and not being fearful of kind of asking people questions. I think the worst thing we can do is not to ask the questions, or to eliminate the possibility that that could be related to sexual health out of fear of how a client or a service user might respond. But I think we're often kind of like in this situation because we're worried about opening up a conversation about something that might feel like it's quite personal. So the example I give is, if you needed to take some time off to go for a GP appointment, would you feel comfortable speaking to your employer about that? And everyone says yes. And then I ask the same question about a sexual health appointment, and everyone's like, oh no, absolutely not. And that just shows how much we're kind of like tied into this notion that we've done something wrong if we get an STI or HIV. And yeah, any way that we can unpick that and normalize testing and talking about sexual health. So some of the really good success within primary care services. There's been kind of like opt-out testing for new registrations at a clinic. It might be also putting it on people's radar. So we have things like Sexual Health Week, National HIV Testing Week, World AIDS Day, just that visibility that says, actually, if you want, even if you as a service can't offer testing, that you'll signpost people to testing. Our testing service we can bring out into different settings. So if you're a GP that really wants to champion HIV and STI testing, we test in primary care services like pharmacies and GPs across East London. So we could do a pop-up testing service in a GP if they wanted us to.
Thank you. Thank you very much, both. And I think if there is nothing else to add from both of you, and if there are no further questions, that will be the end of our meeting. But Sally, my colleague Sally, just sent a lovely message because her connection is really bad. So this has been very interesting, and I will be signposting all the local people I work with to watch this session when it is released on YouTube. I just wanted to say I have learned a lot of things that I didn't know from you both. So did I as well. And yes, thank you once again. Once this is released, obviously we'll let people come to us if they have any questions, and I hope you wouldn't mind me passing them to you if they come. Excellent. And yes, I'll share the link to the video with you as well. So thank you very much. Really appreciate your time and the information you provided today. Have a good evening.
Thanks so much for having us.
Thank you.